Nurse Family Partnership was created to help give babies who are born in poverty a better start in life. Research shows that if you invest early in a child's health and the family's well-being through Nurse Family Partnership, you can improve the child's development and opportunities for success later on in life. Our clients typically are low-income teenagers who are scared when they find out that they're pregnant. They're overwhelmed by the prospect of having to learn to care for a baby and don't know where to turn. Nurse Family Partnership can make a tremendous difference during that window of opportunity of a first birth. Nurse Family Partnership is able to help prevent terrible things from happening, like child abuse and juvenile crime, while empowering young moms to change the trajectory of their family's future. Nurse Family Partnership is designed to help stop the cycle of poverty and ensure that future generations are healthier, safer, and economically better off. Our program provides home visits by registered nurses for low-income young women who are having their first babies. The nurse visits begin during pregnancy and continue until the child's second birthday. The program has been proven through scientific research to enable parents and their first child to be more healthy and productive than what would have been predicted for them. Repeatedly, girls who were homeless, abused, or simply frightened when they enrolled in the program blossomed. They got an education, a job, they learned parenting skills, and gained the confidence to be good mothers. To be successful, Nurse Family Partnership must be sustainable through community support and a combination of good public policy and private funding. The typical young woman who enrolls in Nurse Family Partnership is a teenager who is expecting her first baby. She has little or no money or education, no family support, and she doesn't know what to do. Nurse Family Partnership is a powerful prevention intervention that empowers these young women to experience different lives than their circumstances might have predicted, and in turn, changes the life trajectory of their children's lives. We're unique. Our national organization works with local agencies that deliver the program across the country to ensure that the program's goals are achieved in those communities. The program is designed to help moms have healthy pregnancies, improve the health and development of children, and help families become economically self-sufficient. To be successful, Nurse Family Partnership simultaneously pursues the effectiveness of the program through intense quality control and its sustainability in local communities. After 35 years of research on the Nurse Family Partnership program, we know what works. There's a remarkable body of evidence that shows our program outcomes, increasing healthy pregnancies, improving childhood health and development, and helping vulnerable families become economically self-sufficient. Two things are critical to making sure those outcomes are seen wherever Nurse Family Partnership serves vulnerable families. First, we stay true to the program, which is inherently effective, and we allow only carefully designed enhancements. And second, our national organization works closely with the agencies that deliver the program in local communities so that they can successfully implement and deliver the program with quality. The local communities know their needs best, and that local national partnership is key to being effective and making sure every local program is really making a difference. We want to know if the Nurse Family Partnership Program is changing the lives of children most at risk, those born to young mothers living in poverty. So we measure. We measure the program's effectiveness through the outcomes for those young moms enrolled in the program. There are multiple outcomes tracked that are aligned with the program's goals for a healthy pregnancy and delivery, improvements in the child's health and development, and increasing the mom's economic self-sufficiency. Nurse Family Partnerships and nurse home visitors collect data on every home visit to families in the program. That data is constantly analyzed by our national organization to ensure local delivery of the Nurse Family Partnership Program is on track to make a measurable difference in the lives of the families we help. In addition, our national organization measures the growth of the program in reaching more vulnerable families and the sustainability over time in communities where the need is great. People often don't know that the Nurse Family Partnership is a strong collaboration between our national organization and local communities. Our national nonprofit organization helps communities meet their unique set of challenges by implementing our program of nurse home visits to low-income women having their first child. Our national organization also trains the local nurses and provides the ongoing support they need to deliver the proven program with quality. Local community support ensures the program's sustainability. And although Nurse Family Partnership is delivered by nurses, the program addresses far more than just physical health issues. The Nurse Family Partnership nurses help families understand the social and emotional development of young children. Helping the client achieve economic self-sufficiency is also one of the main goals of the program. Nurse Family Partnership takes a very comprehensive view at what it really means to be truly well for a lifetime. We have had a tremendous expansion of Nurse Family Partnership across the country. 38 states will be implementing NFP in 2012. The program has been successful in both rural and urban settings, and the program is adaptable and serves a diverse population of women. Communities across the U.S. are deciding to invest in Nurse Family Partnership because it's the answer to so many challenges, like preventing child abuse and improving pregnancy outcomes. Despite rapid growth of the Nurse Family Partnership program across the U.S., we know the program is achieving results. We have the data that shows it's successful in increasing healthy pregnancy outcomes, improving child health and development, and helping vulnerable families become economically self-sufficient. We've built that track record of success through strong public-private partnerships. Together, government funding and private donors make this success possible. After decades of proven research showing the program's effectiveness, the nonprofit national organization was established in 2003 to bring the Nurse Family Partnership program to communities across the country. It's complicated work. It's not simple to implement an evidence-based program, to sustain it, and to measure its effectiveness in diverse populations all across the country. But the more we learn from the data being collected, assessing our program's impact on the families we serve, the better we can be. The national organization supports these community implementations nationwide by providing a range of support services like nursing education and data collection and quality improvement support to ensure that local programs can be sustained for the long run and remain successful. We're finding that new challenges often emerge that require fresh vision and greater support from donors. Nurse Family Partnership is a solution to help break the cycle of poverty, but there are so many more moms left to reach. It's estimated that more than 500,000 babies are born to first-time moms living in poverty every year. All children born into poverty deserve a strong, capable mother. Nurse Family Partnership can help give a mom the support she needs to give her child a better future. We now serve only a fraction of that group, about 22,000 moms in 34 states as of March 2012. Additional resources would allow Nurse Family Partnership to expand its reach to serve many more of those vulnerable families. We have an aggressive yet realistic business plan for program expansion, and generous donor support will help us get there. There is a huge population out there that needs help from programs with proven effectiveness. Nurse Family Partnership is proven to change the outcomes for children born into poverty, helping them to live successful and healthier lives. Private donors support the Nurse Family Partnership National Organization, helping us to reach more moms as we work with communities across the country to start up new program sites that are sustainable and that will achieve consistent, positive outcomes for participating young families. We need resources to be able to continue growing and to refine and adapt the program by integrating new research. Other service programs are coming to Nurse Family Partnership for guidance on what we've learned regarding how to translate research into practice. With the right resources, we could better share those learnings to accelerate the results of promising programs. It's about investing in a brighter future, help stop the cycle of poverty, and give vulnerable moms and babies a better future.